I'm Jessica and I'm with the Dream Team, and we are here to talk to you today about what you can do to reduce your risk of Alzheimer's later in life. So what is Alzheimer's? Alzheimer's is the most common form of dementia, which is a general term for the loss of memory and intellectual abilities. It is a progressive, slow-moving disease that starts with memory loss and it ends with severe brain damage. Alzheimer's is fatal. It is the 6th leading cause of death in the United States, only topped by heart disease, cancer, emphysema, stroke, and accidents. Approximately 5.4 million Americans have Alzheimer's. Every 68 seconds, someone else gets this disease. That is 1 in 9 people, or an astounding 11% of people aged 65 and older. Look around you. In this class of approximately 30 people, 3 or 4 of us, statistically, will be diagnosed with Alzheimer's sometime in our life. The symptoms of Alzheimer's include memory loss, repeating questions and statements, poor judgment, misplacing items, mood and personality changes, confusion, delusions and paranoia, impulsiveness, weight loss, seizures, difficulty swallowing, increased sleeping, lack of control of bladder and bowels, and trouble handling money. People with Alzheimer's only live an average of 8 years after their symptoms become noticeable to others. Survival can range from 4 to 20 years, depending on the person's age and other health conditions. There is no cure for Alzheimer's. Current treatments cannot stop the progression of this disease. However, there are a few treatments that can help with the symptoms and improve the quality of life for the patient and for the caregivers. However, there is some good news. There are steps that you can be taking right now to reduce your risk of getting Alzheimer's later in life. And to talk to you a little bit about the causes of Alzheimer's so that we can better understand this disease, I'm going to turn it over to Allie.
Do not know what actually causes Alzheimer's disease, but they believe that it is a combination between genetic and environmental factors that trigger the process in which brain nerve cells are destroyed. They are also investigating genetic targets for late onset Alzheimer's as well, which is the more common form of this disease. At this time, only one gene, APOE, has been definitely linked to the late onset Alzheimer's. Only a small percentage of people carry the form of APOE that increases the risk of late onset Alzheimer's, however. Some studies have suggested that there is an association with serious head injuries in early adulthood and Alzheimer's development. Lower educational levels, which may decrease mental activity and neuron stimulation, have also been investigated. There does not appear to be any evidence that infections, metals, or industrial toxins cause Alzheimer's disease. Family history is also a strong leading factor in the development of this disease. People who have a parent, sibling, or child with Alzheimer's disease are more likely to develop the disease themselves. The risk of this increases if more than one family member has the illness. The following may also increase your risk, although these are not proven well. This includes being a female, having high blood pressure for a long time. 5% of the time, Alzheimer's is caused by specific genetic changes that virtually guarantee a person will develop this disease. Alzheimer's damages and kills brain cells. A brain affected by this disease has many fewer cells and many fewer connections among surviving cells than does a healthy brain. When doctors examine Alzheimer's brain tissue under a microscope, they see 2 types of abnormalities that are considered hallmarks of the disease. The first one of this is plaques, which are clumps of a protein called beta amyloid that may damage and destroy brain cells in several ways, including interfering with cell-to-cell communication. The collection of beta amyloid on the outside of the brain cell is a prime suspect of death in Alzheimer's. The second one of this is tangles, and this is when the brain cells depend on an internal support and transport system to carry nutrients and other essential materials throughout their long extensions. In Alzheimer's, threads of tau protein twist into abnormal tangles inside brain cells, leading to failure of the transport system. This failure is also strongly implicated in the decline and death of brain cells.
So we have talked about what is Alzheimer's and what the current treatments are, but let's get to the good stuff. Let's talk about what we can do now to reduce your risk of getting Alzheimer's. In our research, we found this wonderful website called the Alzheimer's Research and Prevention Foundation. They focus on 4 pillars of Alzheimer's prevention, and they are diet and supplements, stress management, exercise, and medicines. So pillar 1 is diet. Not only is a good diet good for your body, but it supports and enhances your memory too. Your diet is absolutely critical to your brain's health. It needs the proper fuel to function well. The ideal prevention diet looks like this: 20% good fats. That's your extra virgin olive oil, avocados, and flaxseed oil. 40% of your diet should come from lean proteins such as fish, chicken, turkey, or soy. You should have at least one of those every day. And 40% from complex carbohydrates. That's fresh vegetables, whole grains, legumes, and fresh fruits. You should also include superfoods for the brain. This is food like blueberries, spinach, seaweed. These are all really, really good for you. You need to avoid a diet that's high in trans fat and saturated fat, and eat foods that are high in antioxidants like vitamin C and E. It's also important that you take a high-potency multivitamin and mineral capsule, and it should contain folic acid and vitamin C. Pillar 2 is stress management. I want you to think about your computer for a second. You know, sometimes when it starts running slow, it is time to check out the task manager and close some of the processes, or clean up some disk space and defragment. Just like a computer, our brains require regular care and attention to operate at its peak efficiency. It is really important that you practice stress management techniques for a few minutes each day, such as meditation, guided imagery and visualization, hypnosis, deep breathing, massage, or prayer. Now, it's not necessary to lock yourself into any one of these relaxation techniques. Instead, explore any or all of these that seem interesting to you and see which works best.
3 is exercise and brain aerobics. This includes physical exercise, which is anything that gets your heart pumping and your muscles moving. Regular physical exercise can reduce your risk of developing Alzheimer's by 50%. The magic number for this is 150 minutes per week of combined cardio exercise and strength training, including brisk walking, jogging, dancing, swimming, playing tennis, and going to the gym. When you add strength training, which is lifting weights and resistance machines, it helps maintain muscle mass and prevent osteoporosis and related illnesses. Brain aerobics include whenever you challenge your brain with something new or different. You're exercising your brain and improving your brain function. Mental exercise can reduce your chance of developing Alzheimer's by 70%. The magic number for brain aerobics is 20 minutes 3 times per week. The activity needs to engage your attention, involve more than one of your senses, and break a routine activity in an unexpected, non-trivial way. Examples of brain-building mental exercise include reading, writing, playing board games, and doing crossword puzzles. Now pillar is pillar 4, which is medicine. Again, there is no yet... Oh shit, stop. I guess I could have just kept going. Should I just keep going?
Yeah, just keep going. It's fine. Okay. I didn't delete it.
Hold on. The final... Okay. The final pillar for this is medicine. Again, there is not yet a cure for Alzheimer's disease. However, certain medications and hormone replacement therapy can be used to treat symptoms in some patients.
This has been Jessica, Allie, and Rachel with the Dream Team. We thank you for your attention this morning and hope that you have learned at least one thing that you can be doing now to help reduce your risk of Alzheimer's.